Dana Damiani, Capitol Tonight.
Thanks, Dana. Physical therapists in the state are pushing Governor Kathy Hochul to sign a bill into law that would let physical therapy assistants work under general supervision. It's part of a larger conversation lawmakers are having about what they can do to boost the state's struggling healthcare workforce. Kate Lisa joins me now from the state capitol with more on this. Hi, Kate.
Hey there, Camille. So Assembly members passed this bill right at the end of session, and it's headed to the governor's desk, and it would give more flexibility to PT assistants in the type of care that they can provide. And it's one of many steps that lawmakers are taking as they explore expanding the scope of practice for a variety of medical professionals, and as you said, to ease an ongoing staffing crisis.
As it becomes harder to access physical therapy care in New York's poor or rural areas, state lawmakers want to make it easier for physical therapy assistants to fill in the gaps. Democrats and Republicans at the end of session voted to pass a bill to permit physical therapists to oversee a PT assistant's care plan without having to be physically present. It would help physical therapists in smaller clinics and underserved areas continue providing care to New Yorkers needing rehabilitation.
And we had physical therapy assistants who were ready, willing, and able to work, and they couldn't. Right. And so we had patients that had to either be canceled or go unseen.
American Physical Therapy Association of New York President Michael Tisby says physical therapy assistants don't need direct in-person supervision to oversee care for patients. A federal change was enacted in January, allowing PT assistants to practice under general supervision for Medicare patients. Tisby says it's expected to save $271 million in Medicare costs over the next decade.
They also had done studies checking to see about efficacy. If treatments changed, if there was any danger or risk to the public, and they didn't find any.
The off-site supervision of PT assistants is permitted in 49 other states. Senate Higher Education Committee Chair Toby Ann Stavisky sponsored the bill and says the change is needed to improve access to physical therapy treatment in healthcare deserts, especially upstate.
It's a problem not just for physical therapy, but for nurses and all areas of the healthcare professions.
The senator says the bipartisan legislation passed without opposition and is hopeful Governor Hochul will sign it. She hopes support for the change will bolster ongoing conversations with the state education department to expand the scope of practice or legal boundaries for other medical professionals. Medical groups are fighting the proposals, fearing a reduced quality of care. But Stavisky says lawmakers must address the fallout from making changes or the larger consequences of doing nothing as proximity to care dwindles outside New York City.
There are bills like this which require some time in the oven before they're ready to serve.
This legislation was amended before it cleared the legislature for some minor word or technical changes. Governor Hochul will review this legislation when it arrives on her desk sometime later this year. Camille.
So, Kate, you noted other proposals lawmakers are working on to expand the boundaries of a medical professional here in the state or expand the services or treatments they're legally allowed to perform. If that would help ease the ongoing healthcare shortage, what's holding those proposals up?
So kind of touched on that a little bit before. It's that a lot of medical groups, the Healthcare Association in the state, also the Medical Society and others are really worried that changing that scope of practice or the rules that the state education department requires for these medical professionals to get a license would really reduce quality of care, especially for medical professionals like nurses or others that, you know, the type of injuries they can treat and the treatment that they can perform. So it's taking a lot of work over several years, which the senator said is expected with the state education department, but she's hoping to get this done in the next year or two.
All right, Kate, thank you.